Let me ask you something really quick. When was the last time you walked up a flight of stairs without wincing? When did getting out of a chair stop feeling natural and start feeling like a battle? If you are over 60 and your knees have been making your life miserable, I want you to stay right here. Because what I am about to share with you in the next few minutes could genuinely change your day-to-day life. I have talked to hundreds of people in their 60s, 70s, even their 80s who thought their knee pain was just the price of getting older. They thought they just had to grin and bear it. And almost every single one of them was doing something every single day that was quietly making things worse. Not because they were careless, not because they were being reckless, but because the advice they had been given for decades was simply wrong for their age. So before you take another walk, before you do another stretch, before you pop another pain reliever, you need to hear this. And if this channel is new to you, welcome. This is Dr. Alex Morgan, Aging Wellness Lab, and our entire mission here is to give you research-backed, practical, real-world strategies to help you feel stronger, move better, and live with less pain as you age. If that sounds like something you want more of, go ahead and hit that like button right now and subscribe so you never miss a video. We put out new content every week specifically for people over 60 who want to take control of their health. Now let's get into it. Here is the thing that most people over 60 have been told their entire lives. When your knees hurt, you rest. You stay off them. You protect them. Maybe you ice them, take some anti-inflammatories, and wait for the pain to go down. And on the surface, that sounds reasonable, right? Pain is a signal. Your body is telling you something is wrong, so you back off, you give it a break. The problem is that for people in their 60s and beyond, chronic rest is one of the worst things you can do for knee pain. I know that sounds counterintuitive. I know it might even sound a little alarming, but stay with me, because the science here is really eye-opening. When you spend long periods being inactive because of knee pain, a few really damaging things start to happen inside your joint. First, the muscles around your knee, especially your quadriceps on the front of your thigh, start to weaken. And this matters more than most people realize because those muscles are basically shock absorbers. They take a huge portion of the impact and stress off your knee joint every single time you take a step. When they weaken, your joint takes the hit directly. The cartilage, the tendons, the structures inside the knee have to handle load they were never designed to handle alone. And that creates more pain, more inflammation, more stiffness. It is a cycle that feeds itself, and rest is what keeps it spinning. Second, when you are not moving, the synovial fluid inside your knee joint stops circulating the way it should. Think of this fluid as natural lubrication. It carries nutrients to the cartilage in your knee, which has no direct blood supply. Cartilage depends almost entirely on that fluid being moved around through motion to stay healthy and nourished. When you sit still for hours, when you stop moving because things hurt, that cartilage is essentially being starved. Over time, it thins. It deteriorates. The very structure you are trying to protect gets worse faster because you are not moving. Third, and this one does not get talked about nearly enough, inactivity in people over 60 leads to what scientists call accelerated musculoskeletal aging. Your body is incredibly adaptable. It responds to what you ask of it. When you ask it to rest all the time, it adapts to rest. Tissues tighten, joints stiffen, range of motion decreases. And when you finally do try to move, everything hurts more than it did before. So the very thing most people think is helping their knees, taking it easy and protecting them, is actually accelerating the decline. Now, I want to be really clear here. I am not saying you should push through sharp, severe pain. I am not telling you to ignore your body. What I am saying is that the instinct to completely stop moving, to avoid all activity, to wait passively for things to improve, is almost always counterproductive for people in this age group. And what makes this even more frustrating is that most of the standard knee exercises you find online or in basic physical therapy programs were actually designed with younger adults in mind. Things like deep squats, high-impact lunges, heavy leg presses, these moves can absolutely make knee pain worse in someone over 60, particularly if there is any degree of cartilage thinning, arthritis, or joint instability. And yet these are often the exact exercises people are pointed toward when they go looking for help. So what does actually work? What can someone over 60 do that is gentle enough not to cause flare-ups, but effective enough to actually address the root causes of knee pain? That is exactly what I want to walk you through right now. These 5 movements were selected specifically with an older adult's joint health in mind. They focus on strengthening the muscles that support and protect the knee without putting excessive compression or shear force on the joint itself. They improve circulation of that synovial fluid we talked about. They gradually restore range of motion and reduce the stiffness that makes everything feel worse in the morning or after sitting for a while. And for most people, they can be done at home without any equipment starting today. Let's start with the first movement, and this one is deceptively simple but remarkably effective. It is called a seated leg raise. And if you have ever done any kind of knee rehab, you may have heard of it. But the version I want you to do is slightly different from the standard one, and that difference matters a lot. You are going to sit in a sturdy chair, feet flat on the floor. Make sure your back is straight and your core is gently engaged. Now, without locking your knee completely, you are going to slowly straighten one leg out in front of you until it is roughly parallel with the floor. Hold it there for a count of 5. Nice and slow, then lower it back down with control. Do not let gravity do the work. The lowering phase is just as important as the lifting phase. You want to do 10 of these on each leg, and as you get stronger over the following weeks, you can increase the hold time to 8, even 10 seconds. Why does this work so well? Because it directly activates your quadriceps, the large muscle group at the front of your thigh, without putting any compressive load on the knee joint. When you are standing and doing a squat, the force through your knee joint is significantly higher. When you are seated and doing this movement, you get almost all of the muscle activation with a fraction of the joint stress. Over time, stronger quads mean your knee is better supported, better cushioned, and far less vulnerable to the daily wear and tear that causes pain. The second movement is something I call a heel slide, and this one is particularly good for people who wake up in the morning with stiff, achy knees, or who notice that their knees feel worse after sitting for a long time. You can do this one lying on your back on a bed or a yoga mat. Start with both legs extended, then slowly bend one knee, sliding your heel along the surface toward your body. Go as far as you comfortably can without pain. Hold gently at the end of the range for a 3 count, then slowly slide it back out. You want to do about 10 of these on each side, twice a day if possible. The reason this movement is so valuable for people over 60 is that it gently takes the knee through its full range of motion in a completely unloaded position. There is no body weight pressing down through the joint. You are just moving it, just circulating that synovial fluid, just reminding the surrounding tissues that they need to stay supple and flexible. People who do this consistently often notice within 1 to 2 weeks that their morning stiffness is significantly reduced. That is not a coincidence. That is the biology responding to exactly the kind of gentle, regular movement it needs. Now, here at Dr. Alex Morgan Aging Wellness Lab, one thing we come back to again and again is this idea that consistency at a low level beats intensity done occasionally. That is especially true for knee health. You do not need to be heroic about these movements. You just need to do them regularly. The third movement addresses something that almost nobody over 60 is focusing on, and that is hip strength. Now, you might be thinking, my knees hurt. Why are we talking about my hips? Here is why. Your knees are essentially the middle link in a chain that runs from your feet all the way up to your pelvis and lower back. When the muscles around your hips, particularly your glutes and your hip abductors, are weak, your thigh bone tends to rotate inward when you walk or stand. This puts a twisting, uneven force on your knee joint that over time grinds down cartilage and inflames the surrounding tissue. It is one of the most overlooked causes of knee pain in older adults, and it is almost entirely fixable with the right exercises. The movement I want you to try is a lying hip abduction. You're going to lie on your side on a mat or a firm mattress. Bottom leg can be slightly bent for stability. Top leg stays straight. Slowly lift the top leg to about 45 degrees, toes pointing slightly forward rather than toward the ceiling. Hold for 2 counts at the top, then lower it back down slowly. Do 10 to 15 repetitions on each side. Over time, you can add a light resistance band just above the knees to increase the challenge without increasing joint stress. Even without a band, if you are doing this consistently, you will notice a real difference in how your knees feel during daily activities within 3 to 4 weeks. The fourth movement is one that I consider essential for anyone dealing with knee stiffness or mild to moderate arthritis, and that is a standing calf raise done with support. Stand behind a chair or countertop, holding on lightly for balance. Feet hip width apart, slowly rise up onto the balls of your feet as high as you comfortably can. Pause at the top for 2 seconds, then slowly lower back down. Aim for 15 repetitions. Now here's what makes this deceptively powerful. The calf muscle connects to your Achilles tendon, which connects to your heel, and when your calf is strong and flexible, it helps absorb shock when your foot hits the ground. Less shock at the foot means less shock traveling up into the knee. It also helps with circulation in the lower leg, which reduces swelling and fluid retention around the knee joint. There is also a balance and stability component here. As we age, the small stabilizing muscles around our ankles and lower legs tend to weaken, and this leads to subtle gait changes where we compensate in ways that put odd stresses on our knees. Strengthening the calves helps restore more natural walking mechanics, and that alone can reduce knee pain significantly over time. The fifth movement is perhaps the most underrated of all 5, and it is a simple terminal knee extension using a resistance band. I know that sounds technical, but let me break it down. You loop a light resistance band around something sturdy at about knee height, step into the band so it sits behind your knee, and then take 1 step back to create gentle tension. Starting with a slight bend in the knee, you gently straighten it fully, squeezing your quad at the end, then slowly let it return to the slightly bent position. That's 1 repetition. Do 15 on each leg. What this does is something very specific and very important. It trains your knee to fully extend under controlled resistance, which is exactly the motion pattern your knee needs for stable, efficient walking. Many people with knee pain over 60 develop a subtle habit of walking with their knee slightly bent at all times because full extension feels uncomfortable or unstable. Over time, this changes the way load is distributed through the joint and accelerates degeneration. This exercise essentially retrains the quad to fire properly at end range, which restores full extension and dramatically improves walking mechanics. Physical therapists use this exercise regularly with older patients after knee surgery, but you do not have to wait for a surgery to benefit from it. Now, you might be wondering, is there anything I should stop doing entirely? And the honest answer is yes, there are a few things. We already talked about excessive rest, but beyond that, one of the most damaging habits I see in people over 60 with knee pain is what I would call pain-chasing stretching. This is when people feel tightness or discomfort in the knee area and respond by pushing aggressively into the stretch, trying to force the joint into a deeper range of motion. This almost always makes things worse. For an older adult, aggressive static stretching on already irritated tissue creates micro tears, increases inflammation, and leads to that frustrating pattern of feeling slightly better after stretching and then significantly worse the next morning. Instead of aggressive stretching, focus on gentle, controlled movement through a comfortable range, which is exactly what the 5 exercises above are designed to do. Let the range of motion improve naturally and gradually as the surrounding muscles get stronger and the joint becomes less inflamed. You cannot force your way out of knee pain, but you can move your way out of it with patience and the right approach. Another thing worth addressing is footwear, because this is something that flies completely under the radar for most people. Research published in multiple orthopedic and sports medicine journals has consistently shown that footwear with inadequate support or cushioning significantly increases loading forces on the knee joint, particularly in older adults whose foot arches have flattened somewhat with age. If you're doing your daily walks in worn-out sneakers, in flat slip-on shoes, or worse, in hard-soled dress shoes, you are sending shock waves directly into your knee joint with every single step. Investing in a quality pair of walking shoes with good arch support and proper cushioning is not optional if you are serious about reducing knee pain. It is one of the highest leverage, lowest effort changes you can make. Similarly, body weight plays a role that deserves honest acknowledgement. Research consistently shows that every additional pound of body weight adds approximately 4 pounds of force on the knee joint during regular walking. For many people over 60, even a modest reduction of 10 to 15 pounds can produce a substantial, measurable reduction in knee pain. I am not here to make anyone feel bad about their weight, but I do want you to have accurate information because when people understand the mechanical reality of what is happening inside their knee, they are often more motivated to make sustainable dietary changes than they are when the goal is framed purely around appearance. Now let's talk about something that I know is on a lot of your minds, and that is supplements. There's a lot of noise in this space, a lot of products claiming to rebuild cartilage, eliminate arthritis, and restore your knees to their 20-year-old state. The honest truth is that the evidence for most joint supplements is mixed at best. Glucosamine and chondroitin sulfate, which have been heavily marketed for knee health for decades, have shown modest benefits in some studies and no benefits in others. The most recent high-quality clinical trials have been largely disappointing. That said, there is reasonable evidence that omega-3 fatty acids have an anti-inflammatory effect that may help reduce knee pain, and vitamin D deficiency, which is extremely common in adults over 60, has been linked to accelerated cartilage loss and increased joint pain. Getting your vitamin D levels checked and supplementing if you are deficient is a simple, low-risk intervention that could be contributing meaningfully to your comfort and joint health. Collagen peptides have received increasing research attention in recent years as well. Several studies now suggest that taking 10 to 15 grams of hydrolyzed collagen daily along with vitamin C may help support cartilage health over time. The evidence is not ironclad, but it is more promising than what we have for glucosamine, and the risk profile is very low. These are the kinds of practical, evidence-informed decisions that we explore in depth on this channel regularly. Let me also address the question I get more than almost any other when I discuss knee pain in older adults, and that is swimming and water exercise. Many people have been told by their doctors or physical therapists that swimming is the ideal exercise for bad knees, and there is real truth to this recommendation. Water-based exercise provides the benefits of movement and muscle activation while dramatically reducing the load on the joint because buoyancy offsets much of your body weight. If you have access to a pool and you enjoy it, water walking and gentle water aerobics are genuinely excellent choices for people over 60 with knee pain. However, I want to gently push back on the idea that you should limit yourself only to water exercise. One of the most important things you can do for your long-term bone and joint health is regular weight-bearing activity, because gravity, when applied gradually and safely, stimulates bone density maintenance and keeps connective tissues strong. The goal is not to avoid all load on your knees. The goal is to apply the right amount of load in the right way, which is exactly what the 5 exercises I described are designed to do. Think of water exercise as a complement to a well-designed land-based movement routine, not a complete replacement for it. I also want to take a moment to talk about sleep, because this is another area where the connection to knee pain is far stronger than most people realize. When you are chronically sleep deprived, your body produces higher levels of inflammatory cytokines, which are essentially chemical messengers that tell your immune system to stay in a heightened state of alert. This systemic inflammation makes joint pain worse. It reduces your pain threshold, meaning the same amount of physical stress produces a stronger pain signal than it would with adequate sleep. It also impairs tissue repair, so any healing that might otherwise occur overnight is slowed or disrupted. Adults over 60 who consistently get less than 7 hours of sleep are at significantly higher risk for worsening arthritis symptoms and chronic musculoskeletal pain. Prioritizing sleep hygiene, including consistent bed and wake times, a cool and dark bedroom environment, and limiting screen time in the hour before bed, is genuinely therapeutic for your knees, not just your mind. Stress management belongs in this conversation too. Chronic psychological stress drives up cortisol and inflammatory markers in ways that directly affect joint health. People who report high levels of chronic stress consistently show worse outcomes in knee pain studies, even when their physical activity levels and body weight are similar to low-stress counterparts. Whether your stress outlet is meditation, prayer, journaling, spending time in nature, or a creative hobby, making space for it is not a luxury. It is part of a comprehensive strategy for living with less pain and more mobility. One more thing I want you to think about, and this is something that I believe separates people who genuinely improve from those who stay stuck, and that is the idea of patience combined with consistency. The 5 movements I described today are not going to transform your knees overnight. You are not going to do them once and wake up pain-free tomorrow. What you will find, if you commit to doing them daily for 4 to 6 weeks, is a gradual, meaningful shift. The morning stiffness that used to last an hour starts clearing up in 20 minutes. The stairs that used to feel like a challenge start feeling manageable. The walk that used to end with you needing to sit down and rest starts going a little further before the discomfort sets in. That is real progress. That is your biology responding to what you are asking it to do. And once you feel that shift, staying consistent becomes much easier because you have evidence that it works. The people who get stuck are the ones who try it for a week, do not see dramatic results, and give up. They go back to resting, back to hoping things will improve on their own, back to the cycle of pain and inactivity. Please do not be that person. Give these movements the time they need, and I promise you the results will come. If you have found value in what you heard today, please do me a favor and drop a comment below. Tell me which of these 5 exercises you are going to start with. Tell me how long your knee pain has been bothering you, or share what has or has not worked for you in the past. Your experience matters, and it helps other people in this community know they are not alone. The comments on this channel are genuinely one of the most supportive and knowledgeable communities I have come across, and that is because of people like you who take the time to share. And if you know someone over 60 who is struggling with knee pain right now, please share this video with them. It takes 2 seconds, and it could genuinely make a meaningful difference in their daily life. That is exactly why we do this. This has been Dr. Alex Morgan, Aging Wellness Lab. Keep moving, keep showing up for yourself, and I will see you in the next video.